Hey everyone, and welcome. Today, we're going to talk about rhinoplasty. It's this really fascinating procedure that sits right at the crossroads of medical science and pure artistry. And it's so much more than just a cosmetic tweak. It's about fundamentally reshaping structure, function, and a lot of the time, a person's confidence. So let's dive right in.
And just to give you an idea of how common this is, rhinoplasty is one of the most frequently performed facial cosmetic procedures in the entire world. So this isn't some rare niche operation. It's a choice that people from all walks of life make for all sorts of different reasons.
So what are we actually talking about when we say rhinoplasty? Well, at its core, it's a surgical procedure to reshape the nose. But here's the key thing to remember. It has this dual purpose. It can be about improving how the nose looks, how it works, or, very often, both at the same time.
And that leads us perfectly into our first big topic, really understanding the why. What actually motivates someone to choose this procedure? Well, it almost always boils down to two main goals, which, as you'll see, are often tangled together.
So on one side, you have the cosmetic goals. This is all about aesthetics, the shape, the size, the symmetry, how the nose fits in with the rest of the face. And on the other side, you've got the functional goals. This is purely medical, right? It's about fixing structural problems inside the nose that are making it hard to breathe. And honestly, a lot of the time, people are coming in for a little of column A and a little of column B.
Okay, so let's get even more specific. What are the actual issues, both cosmetic and functional, that bring somebody into a surgeon's office in the first place?
On the cosmetic side, it's all about what you see in the mirror. A dorsal hump, for instance, is just that bump you might see on the bridge of the nose. For other people, it's all about the tip. Maybe they feel it's a bit droopy or too round or too wide. It could be about the width of the nasal bones or nostrils that flare out. The ultimate goal is always the same, though, to create a profile that feels balanced and harmonious.
Now, let's talk about the functional side. These are the problems you can feel. A deviated septum is a super common one. That's just when the wall between your nostrils is off-center and it literally blocks airflow. Other things like nasal valve collapse or enlarged turbinates can cause that feeling of being constantly stuffed up, making it tough to breathe, especially when you're trying to sleep or exercise.
All right, so once the why is sorted out, the next huge question is the how. And this involves a really important decision between two main surgical approaches. You see, every rhinoplasty starts with this choice for the surgeon. Are they going to use the open approach or the closed approach? And this isn't just a small technical thing. They're really different ways of getting to the structures of the nose, and each one is tailored for different kinds of cases. Let's break down what that means. This chart really lays out the trade-offs. The open approach involves a tiny incision across the columella. That's the little strip of skin between the nostrils. The reason they do this is it gives the surgeon a direct, unbelievable view of everything inside. It's absolutely crucial for complex reshaping or if they're fixing a previous surgery. The closed approach, on the other hand, keeps all the incisions hidden inside the nostrils. The big win there? No visible scar and usually a quicker recovery. But since the surgeon can't see as much, it's better for more straightforward cases.
And, it's worth mentioning that surgery isn't the only option, but it is the only permanent one. You've probably heard of liquid rhinoplasty, where they use injectable fillers to smooth out minor contour issues. Now, this is just a temporary fix for small tweaks. It's not a replacement for surgery, but it's another tool in the toolbox for some people. So, once the surgeon picks their approach, what actually happens in the operating room? Let's take a quick look at the actual techniques that make up the surgery.
A surgeon has a whole range of techniques they can use. If the septum is crooked, they can straighten it with a septoplasty. To make a wide nasal bridge narrower, they can perform osteotomies, which is a really precise way to reposition the nasal bones. Refining the tip is a true art, and it often involves sculpting cartilage or using tiny grafts for support. And to open up the airways, they can reduce the turbinates to improve airflow.
But look, the surgery itself is just the beginning. The recovery process is every bit as important for getting a great result. So what does that journey actually look like?
Following the post-op instructions is absolutely essential. It's non-negotiable. Simple things like sleeping with your head propped up can make a huge difference with swelling. Strenuous activity is off limits for a few weeks to prevent any problems. And you can't blow your nose. Saline spray is going to be your best friend. Every single rule is there for a reason, to protect the nose while it heals so you get the best possible outcome.
And this timeline really drives home how important patience is here. Yeah, the first couple weeks bring big changes. The splint comes off, the bruising goes away. But the swelling? That's a marathon, not a sprint.
Most of it goes down in the first month, but that last little bit of subtle swelling, especially right at the tip, can hang around for months. It can honestly take a full year to see that final, settled, beautifully healed result.
So, after all that healing is done, what can you expect in the long run? This brings us to the final outcome and how happy people are with it.
And here's one of the best parts about rhinoplasty. The results are designed to be permanent. The structural changes made to the bone and cartilage are meant to last a lifetime. So whether the goal was to breathe better, get a more refined shape, or both, this procedure offers a lasting solution.
And the data backs this up. The overwhelming majority of patients report being really, really happy with their outcomes. They talk about better breathing and a feeling of greater facial harmony. It's that powerful one-two punch of improving both function and aesthetics that makes it such a successful procedure for so many people. Which kind of leaves us with one final thought to chew on. Rhinoplasty is this unique blend of precise medical science and very subjective art. So what does a truly successful outcome really look like? Is it a nose that's technically perfect, one that functions flawlessly, or is it one that simply helps the patient feel more comfortable and more like themselves? It's something to think about. Thanks for watching.